to deal with the things that trigger us into fight or flight, because you can't heal if you're in fight or flight, which is also known as the sympathetic side of the nervous system. And it's the putting out fires place. And you can't heal there. You have to be relaxed in a parasympathetic state to heal. So we have to learn how to put our brains there in a society that feeds on fear, which puts you into fight or flight, and is all about go, 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 stress, 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 chaos, 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 which is more fight or flight. Mm-hmm. We have to change so many things. All right. So
yeah,
I love
right.
the.
I do. I was going to say, I deal with this, and it is the information that helps people. So intelligent people want to get off their meds, but I have to meet them where they're at. And you made a big point. It's changing that palette. When I get their body to start helping them, that's when the magic starts to happen.
Right. Right. And we will crave, if we're given the opportunity, we'll crave the foods that our body really needs. But when all that sensing is turned off by the onslaught of sugar and food chemicals, we can't even get past needing more of those to hear what's going on in our body.
Yeah, exactly.
But
the body speaks.
Yeah. So I do want to talk a little bit more. I know this is a pretty tight time frame we've got, and I want to get into the different ways of changing the mind if we're ready. I didn't talk about how I got sick. If you want me to say a teeny bit about that, I can.
Sure.
It's not. I mean, I thought I was healthy. I developed anxiety and depression in college and medical school and residency. I developed carpal tunnel, an inflammatory condition of the wrists. I developed adult onset asthma, which is highly unusual. And it did give me pause to say, why did I get that with no family history? But I never questioned going on the medications for it. And I was on a steroid inhaler for, I think, close to 10 years, which terrifies me now, right? Wow. But it controlled my symptoms, so that was fine. And I had surgery for my carpal tunnel, and that got rid of that, and that was fine, I thought. But, and I was on medications for anxiety and depression, too, and it sort of controlled it. But I suddenly lost my health literally overnight. In 2002 during my second pregnancy. And I didn't realize I'd been losing it for years and years and years up to there, and that all those other things I just mentioned were signs. They were like big red flags going, you're in trouble, you're in trouble, you're in trouble. I had no idea. But I suddenly developed what's called multiple chemical sensitivities, which is the very nasty intersection of chronic stress, chemical trauma, and, chemical stress, just those two things, really. Chronic stress and chemical trauma, and often an acute stress at the same time is what tips you over. So there really are three things. But so for some people, it's a chemical injury, like they get exposed to a lot of pesticides all at once. For me, I think it was chronic, higher than average exposure with not so great detox pathways or detox pathways that were hindered by my chronic sleep deprivation, because I'm of the generation where in residency we worked 36-hour shifts every fourth day, and you really did work most of the 36-hour shift.
Oh my God.
So, and we had no idea how devastating that was to the brain, because it can't detox when it's not sleeping, to the endocrine hormone system. I had no idea. We just did it. It was a badge of honor, and we pushed through it. And it's really amazing to me that more doctors aren't devastatingly ill, to be frank. But anyway, so what the chemical sensitivities is it's a combination of PTSD, post-traumatic stress syndrome, with chemicals as the trigger, and kind of whole body chemical toxicity. So it's a really difficult combination. And I did all sorts of things. For 10 years, I couldn't find anything to help me get better. I just kept getting steadily worse, steadily worse, steadily worse. It was 4 years into it that I left my job at the hospital because I saw that I was getting sick every day I went into work, and that was just crazy because I came home, I had 2 young children, and I couldn't do the things they needed me to do for them, and I was irritable and exhausted all the time. It was really horrible. And it took me 10 years to discover somebody who had discovered, intuited, whatever, that this PTSD component of the chemical sensitivities, and that the chemicals are triggering your fight or flight, and that just generalizes. And I'm like, oh, well, that's why I'm just like in fear all the time. So the first thing I got that helped me heal was literally learning how to change my subconscious mind into what triggers it. So changing the limbic system, which is your safety center in your brain, and teaching it that, and this was hard because, when you have chemical sensitivities, you learn about the toxicity of chemicals, and you find out that there are 85,000 synthetic chemicals out there in our products, in our food, in our personal care, in our household care, in our clothes, in everything around us, and almost none of them have safety testing. And we're exposed to hundreds, if not thousands a day, and we have no idea what the combination of those does, except that we can correlate the increase in chemicals with the increase in illness in our society.
Wow.
Right? So
And
you can imagine
did you
having... Did I have any what?
Oh, I was just going to ask you if you had any gut disruption, leaky gut from all of that, because I see that often with that type of those check light symptoms too, and that's really.
I had huge leaky gut and gut disruption. One of the first things I learned when I started with the chemical sensitivities was that I had a lot of food sensitivities, and food sensitivities, as you know, are the hallmark of leaky gut, right? You don't have food sensitivities unless you have leaky gut, right? But nobody told me about leaky gut at that time. I just knew that I had the food sensitivities. Right. So nothing was done to fix my gut, but I did get off those foods for a little, and it was pretty miraculous. It didn't help the chemical sensitivities, but I lost like 40 pounds without trying, and I did feel better, but it didn't help the chemical sensitivities. So in the 10 years, I did all these things that were right for healing, but nothing moved the needle on the chemical sensitivities because I wasn't doing anything to change my brain's reaction to the chemicals being a life threat. That's what the brain interpreted them as. So once I learned how to shift the limbic system through a daily repetitive exercise pattern of, then I toned down the reactivity to the chemicals. Then all the things I'd been doing right for the last 10 years could start to actually help me. And then I learned about adrenal fatigue. And then I learned about fixing your gut. And, and then it's just one more thing on top of another. And, had to learn also, it wasn't just chemicals triggering me. There were a lot of emotion triggers. Yeah. So had to deal with, I've done, I would say personal growth has been the biggest part of my healing. Not far behind was learning how to take care of my body, but it's really about learning to use your brain and your mind. And that's why I say you have to change your mind. But, and it's kind of, you have to change you have to make some very different conscious decisions, but you also have to rewire the subconscious mind. So the conscious decisions are like, what type of doctor or practitioner am I going to go to get healthy? So we have to really educate ourselves about what different types of practitioners do and decide, do we want to pop a pill and just suppress our symptoms and let the underlying process continue to fester and cause more problems? Or do we want to find someone who's going to help us figure out, well, what's my root cause of this? Because any illness has multiple root causes, and they're different. You take 10 different people with the same illness, and they have 10 different issues going on, or 10 different combinations of issues. So there really isn't a one-size-fits-all. The next decision people have to make consciously is, what are they willing to pay for their health care? Because conventional medicine fits very neatly in this health insurance model that we have. The hospitals and the pharmaceutical companies and the insurance companies are very wedded together in keeping people embedded in that system. And insurance doesn't pay for the types of health care that get people healthy.
You're right.
Really clear on that.
I'm so sorry, because Dr. Marny, we have to have you back on because we're running out of time. We just got to know, and you're talking about empowerment, and that is one of the most powerful messages you have today, to allow people to know that check engine light means something and that they have empowerment over health. And so let people know where they can find out more about you. Before
my website. Yep. It's outsidethepillbox.com is my website.
And you have a webinar too, right? So what's your webinar that we have available?
Yep, on there is a webinar that is my gift to anybody who wants to go see it. It's at outsidethepillbox.com/learn, and you just put in your name and email, and you'll get access to that webinar.
Thank you. Thank you so much for joining us, and thank you, everyone. And be sure to listen in next time.
Yeah, I would love to come back and finish and talk more about the actual
Thank you, Marny. We will definitely have you back. Thank you so much.
Okay, have a great day.
Thanks for tuning into our show on societybitesradio.com. Don't worry, if you've missed a show, you can find them all on our website at SarasotaHolisticChamberofCommerce.com.